The story of Behavioral Health Equity Work Group really is about working together collaboratively, listening from different providers, hearing the needs, and working with communities. Shortly after we started, we realized that the focus really should be on historically marginalized populations. And what we mean by that is really bringing equitable access to anyone that needs access to behavioral health, regardless of their race, gender, age, sexual orientation, religion. We currently are working on a really fascinating project, and it's video stories from representatives from different marginalized populations talking about their barriers in accessing behavioral health. And we picked individuals not just in the usual big towns and cities in New Hampshire, but we went everywhere to kind of have diverse representation. When we're looking at that equitable access to any program and service, we must also look, how would anybody from the marginalized community feel that they belong here? What am I as a provider doing to make sure that there is that feeling, from the very first opening the door and when they enter, whatever the program is, they have to feel that they belong. The old-fashioned way is we have a problem, let's create a program or curriculum or training. We go through the training, and then we expect results to be a little bit better. And then we all together, we learn that, we have to be better with implementation. And really, what I mean by that, be better at listening and hearing from the community member, having them at the table to help us co-create that plan. So I think the stories kind of get to that from the personal perspective. The stories will really say, this is an individual who has lived experiences, an individual who was maybe homeless and overcame that and remembered or documented the journey of how it was to really navigate these different systems and hopefully provide the feedback, this worked and this didn't work, and you guys need to tailor more resources towards X, whatever the identified barrier was. This is just the beginning. Our hope is to continue having these series because with research, we learned that people learn from stories and videos. We are trying to be innovative and keep up with the new practices, the best practices. And also with collaboration, we create a discussion guide that will help anyone who's willing to address barriers to behavioral health.